Good afternoon, everyone. Thank you, Yossi, AIOS, APAO, Nupur ma'am, for having me here in this interesting session and this interesting talk, charting out new waters from student to a professional. So the journey from being a student to a professional is exciting yet challenging. There is a gap which needs to be bridged from textbooks to the real life patient care. So in this journey, there are multiple things that you learn, right from taking responsibility to your patient, to the importance of comfortable yet professional attire, to hands-on experience and gaining surgical skills, which is very important in this transition. And for that, we have multiple residency and fellowship programs going across the country and globe. This transition exposes you to the real world challenges and how to handle them for the future. So the journey begins, you're sitting in the outpatient department and your first patient comes with history of sudden diminution of vision. There is a list of differential diagnosis that comes to your mind from your textbooks. Now is the time for clinical application to diagnose the patients, to form a diagnosis and treatment. So from diagnosing the patient to treatment to your first surgery, it is always exciting, but there are some heebie-jeebies that come into play. So whether it is your first surgical step or the first complete surgery, it is always important to have a surgical mentor with you. He will not only be there to guide you with the surgical steps, but regarding the complications and also what not to be done. So what are the changes that happen during this transition? As a student, you study cases from the book and you apply this clinical knowledge while diagnosing the real patients. You practice on models to performing live surgeries and giving patient outcomes. You follow instructions which are given to you by your seniors. As per se, there's no decision making, but in your clinics, you have to make certain critical decisions. I remember when I was a student, it was easy for me to say that I will put an aniridia IOL or an aniridia segment in traumatic cataract and aniridia cases. But when it comes to making critical decisions and performing such surgeries, you have to think twice before doing that. So as a student, exams determine the success, but patient satisfaction and outcomes determine success in real life. She is my sister-in-law. I operated her for LASIK. The fact that she trusted me with her eyes, and also there was added pressure for the outcomes because she was my sister-in-law. So the biggest shift is responsibility and decision making. Also, it is very important to have an effective doctor-patient communication to break the bad news, to explain the diagnosis, to explain the prognosis with ethical considerations in practice. This transition teaches you teamwork because ultimately we are dealing with patients, and for the sake of patients, we need to learn teamwork. We need to know when we should ask for help, and if I'm an anterior segment consultant, so if I need to refer the patient, I'm not hesitant in doing that for the sake of patient. So this journey is not quite easy. You enter graduation, that is MBBS, then residency, and your first patient encounters with mastering new technologies and fellowships to choosing a career path, whether it is academics, research, or practice, and then finally you become an expert or a mentor. So it is always a work in progress. But there are certain challenges in the transition which everybody face, like managing work-life balance. For a student, there is nothing known as a work-life balance, but as you move on, as you become a professional, it is very important to keep your work and personal life in balance. Everybody makes mistakes, but it is important to learn from those mistakes and cope with failures and keep moving on. So it is a continuous learning process. Seek mentorship, stay updated, and adapt to new technologies via conferences like this, or we have YouTube channel from Yossi, which you can subscribe, and we have all the updates which Yossi, like webinars, all the conferences, you can stay updated. So for all the students out here, everybody has done it. You will also do it. The journey is very exciting. Just keep charting out new waters. Thank you.
Thank you, Dr. Lippy. That was very well presented, charting out new waters. I'm sure all of us have gone through that, and it was an absolute nostalgia, that developing those skills of decision making and leadership. I think it takes around initial 3-4 months to really settle in. When you're just a student or an intern, and suddenly you're being thrust upon with so much work. So, any comments from the panelists?
Congratulations on graduating so well from your training that you could operate your sister-in-law.
Thank you.
Very, very important.
So true, same. I think you must be having excellent communication skill and patient trust building skill.
Yeah, that is
Yeah,
again a transition process, and that is what my presentation was about, like learning those skills during the transition.
great,
Yes.
great.
So, if do you have any, pointers to give to somebody who's starting on that journey and needs to know how to communicate to the patient?
So, patient counseling is very important, ma'am. Not just the good things, but also explaining or breaking out the bad things. So, it also depends on the patient mindset. You need to understand the patient mindset, how the patient is, where the patient is coming from, how what patient is expecting. So, I learned that from my mentor, how the way he used to communicate to the patients, and the way I would go to a doctor and I would want for myself or my relatives to get communicated. So that thing, taught me how to communicate with the patient.
I think it's a very good, time to also learn the good bedside manners, learning to be courteous
Yes.
to, because the habits you develop during your residency and training, they carry forward as you become a consultant. So it's very important that you work on those because during residency we have a humongous load, and sometimes all this may seem like a task, greeting every patient, trying to be, you have 10,000 works to do, but always remember that the good habits you develop at this point will always carry forward in your when you become a consultant. Yes. Yes. Also, so there was this, as Apurva was talking, we had a debate on, the art of refraction. Is it needed during residency? I mean, should it be taught or not? So I think every resident must learn the art of refraction. It happens when we enter residency. It's all about, it's become the norm, how much cutting you're going to get. But do not forget that you need to be clear on your basics, and refraction, history taking, good clinical examination will always remain your basics. If you're not clear with your basics, if you're not good with your OPD skills, your surgical skills are not going to matter, because ultimately what will get you the patient are these skills, how well you're doing your refractions, how well are you satisfying your patient, how good are you talking to the patients. So have a comprehensive outlook. Do not be, just focused on cutting and numbers and surgeries, but try to have a comprehensive outlook. So we're also joined by Dr. Avanish. He's just joined us. He's our co-chairman, and I've already introduced him. He's a vitreoretina surgeon at IQ Group of Hospitals. So welcome, Dr. Avanish. So any more comments from any audience or any panelist?